Hey, everybody, and welcome to the Mental Health America Monday Story Series. Today, we're going to hear from PJ McEnroe from Emerge Family Therapy Center and Teaching Clinic. Thank you guys again for coming out, and PJ, take it away.
Very good. Thanks so much for having me. Really appreciate it. Like Jeremy said, my name is PJ McEnroe. I'm the Executive Director of Emerge Family Therapy Center and Teaching Clinic. And I myself am a licensed marriage and family therapist, but primarily do the administrative part of our organization's work at this point. Really excited to share with you all about Emerge and what we do. We've been, and we'll see a little bit of this in the coming minutes, but just to share briefly, we've been around and in the upstate for coming on 25 years here, and a little longer than that if you go back to the real origins of our organization. But really been providing low-cost therapy in the upstate for the last 25 years or so. But we just recently launched right when a certain pandemic hit us. We launched a new campus in Greenville at University Center of Greenville. And just to plug this right off the bat, you'll see on the screen that's been shared with you that right now this will not go forever, but for right now, we're offering 6 free sessions, and that's in person or virtual through the Greenville Clinic. So if you are interested in that, please give us a call at the number listed there, 864-565-7010. So with that, let me launch into a little bit of what we do and how we do it and why we do it. All right. Emerge 101. Here we go. So the basics of Emerge. So what we do is we train mental health professionals by really operating as the administration piece and the operational element of a clinical experience that students need to have in order to get their master's degree in our case, primarily in marriage and family therapy, but we can help with some licensed professional counselors as well. As a result, we're able to use these really highly skilled and budding professionals, use their talents and their expertise, and we match them up with the community and provide low-cost services to the community. And we just kind of get in the middle just in order to help facilitate that and to keep everybody happy and moving along. So some annual statistics. We provide, and this is without the Greenville campus, and so we expect that this will look different in the years to come, that these numbers will grow significantly. But we provide over 12,000 hours of low-cost counseling every year. That's an awful lot of hours, and we serve approximately 3,000 families, couples, and individuals. And so you pick a small town in the upstate, Landrum is one that I often refer to. We roughly serve Landrum every year, and you can imagine the impact that has, and that can have on a community, but also have on families, and the sphere of influence that a family has, as well as the individuals that come in and what that means in terms of their workplace, their health in their workplace, their health in their relationships. And then we graduate and or launch roughly 20 skilled therapists out into the community every year. And so many of our graduates end up doing the first couple of years out of our program. They go into and they partner with other nonprofits in the community that are doing really great work for the community, and it's a great time for them to get some experience within an agency model and provide really great services through those other nonprofits. And so we love to partner with nonprofits that are doing some really great work in the community. Let's see. So who do we serve? Families, couples, and individuals. And there's really no limit on age. One of the questions we routinely get is how young will you start serving clients? And the answer is really from birth. And that might sound funny, but there are actual techniques that will help people, that will help babies, infants, to whether they had a traumatic birth or something of that nature. There are actually things that we can do to help them progress into and to get on track with their development. And so we're happy to be a part of that process. And a lot of the work that we end up doing in those early years ends up being parenting work. And we're happy to come alongside parents in that. Families is really, that's our strong suit. We love to work with families. We've recognized, and it's really the origin of who we are as an organization, that families are the primary impact and catalyst for change in our society. And so we love to work with families, and really families is defined by the family. We don't define that in any way. And so we have had folks that have no legal binding to one another, but they consider themselves family, and we are happy as could be to work with them as a family unit. Couples, same thing. If couples that see themselves and want to develop that relationship and need some assistance, we are really happy to engage with them. As is listed here, we pride ourselves on being an ally of the LGBTQ plus community and an anti-racist organization. And so we strive to take steps to actively engage the LGBTQ plus community and to further the anti-racist communications and movement of our society. We have, in having said that, we have a diverse pool of clinicians, and it's really fantastic that we have such diversity, and that means from religious backgrounds, from socioeconomic backgrounds, from racial backgrounds. We have a lot of different people that come through our program and are learning to become therapists, and therefore we're able to meet the needs of the community using that diversity, because obviously our community is diverse as well. Excuse me. So how do we serve? Well, it's really quite simple. We have two clinics. We have one at University Center Greenville. So that's the old McAllister Square. And then we have a Spartanburg location located near the Mary Black Hospital campus. And so all in-person sessions happen at those two locations. Or I should say the vast majority of in-person sessions happen at those two locations. And so if you want to be seen in clinic, then you would go to one of those two locations, and you can call those numbers that were on that opening screen, and I'll share that at the end as well. Then we also, especially during the pandemic right now, we are offering virtual sessions as well. That was not available before March of 2020, but we quickly adopted that as a method to provide services. And so we're happy to provide that, and we'll be doing that for the foreseeable future as a result of this. And then we have numerous partnerships in the community as well. We have quite a few partnerships in Spartanburg County, and are developing and actively seeking partnerships that are really great opportunities for our students to learn, as well as great places for us to step in and provide services into the community over in Greenville. And so the partnership list that I'll share in a little bit, you'll see is pretty heavy on Spartanburg County, but that's because we've been here for a long time, and we look to develop that in Greenville as well. We love to partner with great organizations. So what does it cost? So if you were to see myself or another professional in the community, it is not uncommon for us to charge you $120 to $150 per session. That tends to be about an average rate right now. we operate almost entirely on a sliding scale fee structure. And so our session started just $8 per session. And we calculate the sliding scale and where somebody falls on that based on the annual household income and the number of people living in the home. So this makes us a really great service for those that are uninsured or underinsured. And we do our very best to remove any barriers to entry. Mental health care is really important to get to all pockets of our community. And so we do what we can in order to remove the barriers. And so we don't ask for income verification. We don't ask for example, citizenship verification. Things of that nature. We want people that need services to get services, and it's really that simple. Let's see, we're a financially self-sufficient organization, and so we don't have to do a lot of fundraising and that kind of thing in order to make this work. And so, but it's fees such as that $8 and up. It's fees like that make that possible. And so we are a fee-for-service nonprofit. So speaking of nonprofit, here's the basics of our structure. We are a 501c3 nonprofit. We have a board of directors that acts as the CEO on behalf of the community, and then myself and our team execute the daily operations in line with that board, the board's objectives and bylaws. So we do have an oversight that is community-based and community-oriented. So that's the basics of Emerge and kind of what we do. So our purpose, our mission statement is to train therapists, provide quality, affordable counseling, and strengthen the community. And everything that we do, we filter through that mission statement, and we try to be as consistent as we can in that. For our history, founded back in 1980 by these two strapping young gentlemen, Dr. Jim Rentz and Dr. Jim Pruitt. And we were founded as Westgate Training and Consultation Network. If you're familiar at all with Spartanburg, which is kind of the home base for our organization, you'll know that there is a Westgate Mall, and we are located absolutely nowhere near it and never have been. And so we would get asked all the time where we are near the mall. You know, I'm by JCPenney. You know, where are you? And so we went through a rebrand and rebranded as Emerge. And the idea of Emerge is that we desire for everybody that has an interaction with our organization to emerge on the other side as a healthier and more whole person. So these two gentlemen founded this back in 1980, and Dr. Jim Rentz was a chaplain in the Army during the Vietnam War. He tells the story of when he was on the battlefield and in a really rough battle, you know, unfortunately, his fellow soldiers were unfortunately being taken out all around him. He basically offered. He made a deal as a chaplain. You can imagine that he was a man of faith, and so he made a deal with God, saying, "If you get me through this, I will dedicate my life to bringing peace on earth." And Westgate, what we do at Emerge, this was really his way of doing that. He recognized that the family unit is the best place for peace to be spread on earth. And so that's the seedling that was planted many, many years ago that has then been birthed and grown into the organization that we are now. And so we're really rooted in that understanding of bringing all that is good and healthy into the world. One of the best ways we can do that is by helping people, helping individuals, couples, and particularly families. Westgate brought this concept of marriage and family therapy into the region. MFTU is a relatively new and unique structure within the helping professions. And so really Westgate was intended at the very beginning to just teach those that were already professionals in the field, to teach them how to become marriage and family therapists, which is really a slight shift in thinking where we as MFTs tend to think in a systemic model, meaning that we're just not isolated. every one of us operates in a system of some sort. And so it's really a misnomer to call it marriage and family therapy, because we obviously will work with lots of folks and really anybody. And so it isn't just those that are in couples or in a family unit. But we broadly apply the systems theory to the field of counseling. I won't bore you too much, I promise, with the systems theory, but for those that might be interested, it's really rooted in some engineering philosophies, if you will, and it's just applying what they know about how systems need to work together and applying that to the psychological or social and interrelational constructs. All right, so then currently, again, going back to the mission statement, our mission is to train therapists, provide quality, affordable counseling, and strengthen the community. So how do we train therapists? What do we do? So we have 3 levels of therapists. We have student therapists, and student therapists really need to complete 500 hours of clinical work over their 15 months that they're in the clinic. And that's their requirement for graduation from a master's program. Within our structure, that means that the lowest paying clients on the sliding scale see those students, and that's so that we can pay some of the other levels a healthier living wage. The students are, of course, supervised by licensed professionals, and that is through Converse College, which is our main partner here in the upstate, or with some supervisors that we hire and bring in for folks that are doing folks that may be doing their academic work through an online program or something of that nature. And then the students pay a tuition into Emerge in exchange for this experience, and that's listed in order to really paint the picture of that self-sustaining model that we try to operate in. We want to be helping the community that we step into, and not that fundraising isn't helping or that it gets in the way of helping, but we want to do what we do best, and this is a way for us to do that. Let's see, associate level therapists. And so these are folks that have already graduated from a master's program, but they are not fully licensed by the state. That takes about another 2 years, and as is listed here, they need to get another 1,350 hours in order to achieve that. So if anybody's interested in going into the helping professions, know that it's a long road. It is not, we wish that the state would be maybe a little quicker to get folks in order to be paneled by insurance companies and that sort of thing. But we also appreciate the rigor and the steps that have to be taken in order to kind of hang that license on the wall, if you will. Let's see. So within our system, again, like I mentioned, these folks are paid a slightly higher rate, and that's so that they can again have a living wage. And again, they're supervised by fully licensed professionals. And then the third level is that we have a few excuse me, we have a few staff therapists on our staff as well. And so these are fully licensed clinicians that are paneled with insurance and often are used as supervisors to kind of feed back into that system. And we'll also teach the CEUs, the continuing education. And that's another thing that we do in terms of the training of the therapists, is that we do provide continuing education to local professionals. And sometimes that's just, like we had one workshop, I guess it was not this past Friday, but the one before. We'll have another one this coming Friday. And so just different topics of interest in order to keep all of us clinicians up to snuff on some of the very best and most cutting edge data and information that's coming out, as well as methodology. So back to the mission statement. So providing quality, affordable counseling. I already mentioned some of this before, but this again is our impact. So 12,000 sessions per year, 50% a little lower than that right now. The last measure that we took was 46%. 46% of clients live at or below federal poverty level. And so if you're not familiar, that's roughly, it's just under $12,000. So an individual living off of $12,000 for the year, that's the federal poverty level. And so almost half of our clients live at that level. And so you can see why a sliding scale system would work really well for them. They can come in and they don't have to, they receive high quality services for pennies on the dollar. Serve roughly 3,000 clients per year. And then the charitable services that we give away equates to roughly $350,000 per year. And so we try to make a big impact, and again, doing that in a self-sufficient way. So this again is some review in comparison to what we talked about before, but some of the externship sites, and we'll get into some of the partnerships here in a second, but some of the externship sites that we currently operate out of, Spartanburg County Detention Center is a really interesting one. That's where our students get to go into the detention center and provide services to some of the folks that have some of the most significant needs in the community. And so that's been a great partnership that has been developed over the years. Same with Burns High School. So obviously a different scenario, but we go into Burns High School and we work with some of the classes there and provide some group therapy work that has really been shown to be really productive, really helpful. Social emotional learning is a big thing right now, and we couldn't be happier for that. We think that that's a really critical piece for our youth to grow up into healthy, thriving adults, and just to be healthy and thriving as students right now too. And so we're a part of that, and we're a piece of the puzzle, if you will, for how that looks at Burns High School, where we go into these classrooms and work with groups of 20 or so students. Obviously that looks a little different this year than it has in years past, but we still go in and work with these students in a classroom setting in order to help them to understand their own social emotional health. And then we also have partnered with medical offices and some other schools and nonprofits, like I was mentioning before. Strengthening the community, here you're going to see all the partnerships, or many of the partnerships that we are part of. And again, you'll see that many of these are Spartanburg based, but some of them are regional, and many of these we would love to see replicated in some fashion in Greenville as we establish ourselves there. Some of the key ones here, Access Health and Burns High School. So Access Health provides basically insurance for the uninsured. It's a really rudimentary way of saying it, but Safe Homes Rape Crisis would be very similar to Safe Harbor in Greenville, the detention center that I mentioned, and then we try to partner with the Department of Mental Health as we're generating these therapists. Many of them end up working for the Department of Mental Health as they're the primary agency providing mental health care in the state. And so that's been a really great partnership as well. We are also an EAP provider for a couple of as is listed here, Contech and Jan Smith Corporation here in the upstate. And then in the future, we just look to continue our impact and our commitment to the mission. As is listed here, our partnership with Converse, including the expansion into Greenville right now, we continue to look for opportunities to grow. And as I just mentioned, we would love to partner more and more. We recognize that there are other organizations that do really great work, and so we don't want to duplicate that work, but we want to come alongside and do what we can. Let's see, So that really concludes this. As I move to the last screen, that'll have the contact information again. Really would love to be able to answer any questions that anybody might have, and share anything that would be of particular interest. But thank you again for having me. I really appreciate it.
PJ, thank you so much for jumping on. I'm not seeing any questions in the chat, but if anybody has any questions they'd like to ask, feel free to either post those in the chat or go ahead and unmute your mic and ask if you'd like. I did have one with the free sessions. Does that include any group therapy sessions, or is that really just the one-on-one sessions?
It's really the one-on-one. We do have one group that is being offered right now, and it's $5 per session. And that is, and that's at the Greenville campus. And so if anybody's interested in that, that's really trying to deal and doing a lot of coping skills with our current situation with the COVID-19 pandemic. And so that is something that can be done. And what I would say in regards to the free sessions versus not free sessions, one of our unwritten rules or mantras is that we will never turn away anybody for financial reasons. And so if group sessions are what is needed and desired by any individual, and but they hear, oh, but that's not part of the 6 free sessions, please call us anyway. We would love to have a conversation, and we can discuss that for sure.
Awesome. And then also, are you required to live in county limits to use any of the services?
Not at all. Not at all. Again, we want to remove any barriers to entry. We're not confined by that. We don't receive federal or even county dollars. And so we really get to be very, very free and easy with access to services. So anybody that is willing to come in for services, and right now with virtual sessions, they just have to live in the state of South Carolina. It's really that simple.
That's great. Well, thank you so much for jumping on, PJ.
My pleasure. Thanks for having me.
Yep. And we'll definitely be in touch. And, if you guys have any other questions, I'm sure they're able to email you or reach out through the phone numbers.
Absolutely. Please do. Give us a call. We'd be happy to answer any questions you might have.
All right. Well, then I want to thank everybody else again for jumping on, and everybody have a great day.